I would like to introduce our speaker for today. Wendy Lustbader is a clinical professor at the University of Washington School of Social Work, teaching advanced clinical practice. She's the author of several books that have earned her a national reputation in the field of aging. Wendy's first book was co-authored with Nancy Hoyman, Taking Care of Aging Family Members. Her second book, Counting on Kindness, helps readers to comprehend the complex feelings that arise when we become dependent on others for help. Her latest books are What's Worth Knowing, a collection of pithy insights gathered from older people, and Life Gets Better, which explores how life improves as we get older on every level except the physical. Wendy is a skilled psychotherapist, having worked almost 20 years with people from all walks of life at a community clinic in downtown Seattle. She's also a popular speaker at conferences throughout the United States and Canada, using storytelling to animate complex subjects. And we are in for quite a treat today to learn from Wendy Lustbader on grief and loss. Welcome, Wendy.
Barb, do you hear that? Okay. Well, I am so grateful to have people in front of me in the room, as well as all of you who are remote, because I'm a storyteller and I have to have human beings in front of me. So thank you for having this live audience. I want to start with a story, but before I tell you the story, I want to give you the theme of this whole time together in one sentence. Grief heals when it's received by a caring other. That's the whole talk. You can now turn it off now. So often in modern societies, especially as we are all on media, we do not grieve in the presence of caring others. All traditional cultures across the world, which are older cultures, all of them have grief rituals that put us together with caring others when we are grieving. If you study anthropology and you look at ethnography of different cultures, you will see these grief rituals. So I'm going to show you today what healthy grieving looks like, which is largely based on what has been known by human cultures for literally thousands of years. And then we'll look at unhealthy, what I call non-grieving. And then the last part, I want to look at healthcare practitioners. And what can we do when the time constraints are so intense on us and growing more intense all the time? So as you're listening to things in the beginning and you're saying, oh man, I can't use any of this in my work, try to stay with me. First, we have to look at what's really true and what's really right for human beings. And then talk about what can we do in a setting where we have become increasingly constrained. Because if I ran the universe, healthcare providers would have plenty of time with patients and clients to be able to be what I'm going to call today a grief receiver. And that's where we're going with all this. But the first story is a story that Kubler-Ross told at the Paramount Theater in Seattle many, many years ago. And I went to hear her. She was like a goddess at the time. And she stood up on a bare stage with a microphone, this older woman, and spoke with such power. And I felt so honored to be in her presence with another couple thousand people. She said at this hospital floor for people who were dying, there was a younger patient, a man in his 30s, who was in active dying. He was just days away from the end, but he would not talk to anyone. He just put his back to where people came to take care of him, and he faced the wall, and he would not respond. And they knew he was quite awake. And everybody was just so upset that he would not speak, so they couldn't give him the care, emotional and loving care they wanted to give. Kubler-Ross ran a very beautiful operation. And finally, this is what Kubler-Ross learned. The cleaning lady would go into the hospital room and clean near this man's bed. And she would mop the floor much more than it needed to be mopped. She just loved to be with him. And she mopped and made it shine. And she even squeezed into the place between the bed and the wall and mopped. And did this 3 or 4 times a day. And then one day, this young man started to speak to her. And he spoke his ever-loving heart out. And he wept, and he talked, and he wept. And she just mopped and mopped. And this came to the attention of the care team, this story, and Kubler-Ross said to everybody, we need to know how to do this. We need to know how to be with and receive the feelings of the people we care for. So another theme of this talk is being with. And so I'm going to show you just the fundamental art of this on both levels. If we have a grief, a sorrow, a suffering that we don't express to anyone, it just goes around and around and around inside of us and remains static. Nothing becomes of it. And it doesn't go anywhere, it stays the same. If we take the sorrow, the pain, the suffering, and it is received by a caring other, someone who's listening with an open heart, it leaves our body quite literally and comes out. The suffering comes out of us. So this is a momentous thing to feel the relief of having received comfort. And that's what we're going to explore a little further. Okay, so what does healthy grieving look like? Well, I think I'm going to read to you a summary of it. I tried to put together, I wrote a book about life getting better as we get older on every way except the physical, but I couldn't write that book, make that statement without talking about loss. So this one paragraph ended up becoming my favorite paragraph in a book about life getting better. It's what we learn about loss. Inside all of us is a great pool of grief. It keeps enlarging as each fresh loss is added to the others. So as we get older, we start feeling this pool of grief inside of us because we keep getting more contributions to it. We often find ourselves weeping for old sorrows along with the new. This is another thing that is true about grief, that when you have a fresh loss, you cry also for the previous losses. Over the years, we learn how to dip into grief for a while, and then we step back out into the oxygen of love and life. Grief is part of life. Grief is, we go in and out of it. It's not to be afraid of it. It is life. Because we wouldn't grieve if we hadn't gotten close to someone and dared to love. We wouldn't grieve if we hadn't taken the risk of closeness. I was giving a talk at a conference, and a man who didn't speak English, but barely, came up to me at the end of the talk about grief, and he said, I understand what you are saying. And I went, tell me what I'm saying. I want to understand it too, all the way. And he said, to grieve is to experience a relationship. Best summary I ever heard from a man who had to put those words together with a dictionary. To grieve is to experience a relationship. What a great honor grief is, because it means you have that. and you still have it on the heart level. So that's why over the years, we learn how to dip into grief for a while and then step back into the oxygen of love and life. It's not that we get good at it, but we know what we must do and we do it. Grieving doesn't get easier, but we acquire the skills to bear it and the wisdom to accede to its rhythms. And that's what Kubler-Ross was saying to her team. We must accede to what grief needs. And that often means a very silent, caring presence without a bunch of hoopla. That's very humbling as a social worker, because we want to always be helping people express their feelings, but there is an art to it, and the art to it is largely in letting go of your sense that you can really help people grieve. It's rather that when people are ready to release their feelings, that you know how to handle it the right way when that happens, which is a whole different kind of expertise. Took me a while to learn it. Okay, and I hope to shortcut some of you with this talk. Okay, so healthy grieving is often wordless too. So when my mother-in-law was in the hospital with her colon cancer, and yeah, they were able to take out a lot of it, but not all of it. And I knew she was grieving what she had thought was at least several years left to live, and her life had been shortened by this cancer, though we didn't know how long. And she was pretty silent. And I learned from a nurse. Some of my best teachers have been nurses. She said, Wendy, you know, you social workers are so into talking, but we in nursing have some wonderful things we can do with touch. And so I wanted to know some of those secrets. And she said, if someone will let you put cream or an oil on their feet and gently massage their feet, you have to be careful not to tickle them. That's number one. People will receive the comfort. You throw in a little bit of a massage, just what a person can tolerate and enjoy. So the first time I got to try it was on my mother-in-law, a Holocaust survivor, a woman who kept her feelings behind a wall. And we will be getting back to that. So she's laying there in the bed, and I said to her, could I put a little cream on your feet? It's looking really dry down here. She goes, oh, that would be great. And I went, okay, so I'm going to not tickle you. I'm going to just grab your whole foot and hold it. And then I'll put on. She goes, good, good. And I will never forget this. I solved the tickle problem. I had her foot in my hands, and I slowly put it was a very good lotion on there. And I felt her whole body unclench. The body, the mind, and the spirit are really one. And in the unclenching that I felt, her whole visage, the whole look of her softened. In fact, it got so soft there in the room, wordlessly, that we both stared at a TV screen the sound was off, because the emotion in the room was so powerful, we both couldn't look at each other. How about that? It was so intense and beautiful that we stared at the screen. And I gave her comfort, and she was quietly crying. Just little sniffles and not a crier, I'll tell you that. Beautiful, beautiful moment that portended what was to come. So we'll leave that there for now. So healthy grieving can come in so many forms that we have to understand that people will grieve in their own way. An award-winning griever for me was a woman, I think she was in her early 80s. She lost her husband of more than 50 years, 60 years, I don't remember. And what she loved to do was go in the closet and sniff his suits, his wool suits. because wool holds the smell of a person better than any other fabric. And she would just go in the closet and sniff when she was really missing him and weep and be with his suits. And then, unfortunately, one day her daughter came over and was knocking and didn't get an answer while she was in the closet with the suits. And the daughter used her own key, worried, and came in and caught her in the closet with the suits. The daughter was going to just take them all to Goodwill immediately because she thought it was so peculiar. But the older woman, the mother, said, "Don't you touch those suits." That's where I grieve. Leave it alone. So we all grieve in our own way. Okay, so with healthy grief, those of us who are friends, family, healthcare practitioners, all of us, the key understanding is that being with is what people need. And I have two stories on being with, and then we're going to move into the problem of people who are unable to grieve. So what links these two stories is a remarkable sentence that both of these people told me, and they were far apart in time and circumstance. And it's something I think about often, this one sentence they both said. The first one was, I was with visiting nurses after getting my MSW, and I went out and saw lots of people in their homes. And this woman was referred to us by her daughter, saying, she qualified for home care for nursing or rehab, one of the two. But a social work referral came because of the daughter, saying, "My mother will accept no help in taking care of my dad who has advanced Alzheimer's, and I'm so worried about her." So I went out on some pretext and then started talking to the woman. And I said, "Well, can I get you someone to sit with your husband so you can go shopping?" "No, I'm fine, dear. Can I get you someone to maybe do the laundry, to ease your burden?" "I am fine, dear. I really don't know what you're doing here." I said, "Well, I'd like to just, anyway, I'm doing my thing and not succeeding at it at all." And all of a sudden, no warning, her husband appeared. So it's a very beautiful, immaculate living room. We're both sitting on a couch, and there's like it was a fancy house, like a fancy formal dining room back there. He came in through some side door I hadn't seen. He's wearing a three-piece flannel suit. I can remember it like it was yesterday. And he's beautifully attired, handsome elder, and he walks over to us. And as he's approaching the couch, he's in the living room at this point, he parts his legs and starts urinating through his beautiful suit. And the urine ran down his leg, across his shoe, and then across the immaculate rug. And then when he finished what he was doing, he stepped over the urine and just walked into another room. And I'm just watching, and all of a sudden the couch starts to shake. And this woman is sobbing so hard, she literally can't breathe for a few minutes. There's just that kind of wrenching sobs. And I can't even imitate it. And I was just not knowing what to do. What do I do? And I knew that she just didn't want anyone to touch her. And there was nothing to say. So parenthetically, as I continue the story, I want you to know, if you feel speechless in your service to others or in your relationships with someone, honor that speechlessness. If you're speechless, never fill it up with BS, right? that speechlessness is a valuable indicator of something, which I'll show you. So she wept, and I sat there, and I had tears in my eyes. The power of this weeping was bigger than really anything I'd ever witnessed up close. And then it started to subside with gulps of air, and she fell silent. I think I handed her a tissue I happen to have. And when she collected herself, she said, "Thank you so much. You were with me just now in the loneliest moment of my life. You were with me in the loneliest moment of my life." I want you to know I had felt pretty useless during the weeping, but she taught me that presence and an open heart and being with is enormous. And I can tell you that ever since that day, the most valuable things I have done with patients are the things I couldn't put in my chart notes because Medicare didn't pay for it. You can't write a Medicare chart note that says, "I said absolutely nothing, and I received this person's pain and sorrow." But that's the greatest work that I have done, is what I can't report. It's not billable. I say that with a sense of humor and great sadness. We've been trying to make things like that billable because it's so crucial. But that's okay. We're going to do it anyway. And more on that when we get to the end of this talk. So the second story about being with is even heavier than this one. And I equally felt helpless. So if you feel helpless around someone suffering, try to remember these stories. If the stories stay with you, some people can keep a story, and the story will keep you company when you're in one of these situations. I won't go into great detail. I have a lot to cover, but I'm just going to say that I went to a very small liberal arts college in the East, very tiny place, and they had a priest who worked there. There was a rabbi, there was a reverend. They had these services back then for students, and I had gone back to the college for a year to be a dean of the junior class at a very young age because someone had walked off the job and they needed somebody fast. Okay. Someone got me a sweatshirt that said, "I was a teenage dean." I was barely in my early 20s, just after graduating. Okay. And then something momentous happened. A student died by suicide. And in a very small community, in any community, it has a huge impact. And everybody was saying, "What do I do? What do I do? What do I do?" And I'm not here to talk about this part of the story, but just to tell you that I did sit in the room with all of his housemates for about 12 hours while everybody wept. So I was a grief receiver, that's for sure. But here's the story that I'm really telling, is after that, the father was coming up to campus to get the son's belongings. And the priest and I were assigned the role from the president of the university to be there with the father. So the priest and I met in the young man's room, and all the stuff was there as he had left it. And we were both paralyzed. We had several hours till the father was going to be there. And he and I talked for a while. And then the priest began sobbing, such wretched sobs. And he fell apart. This man that I looked up to and admired, one of the beautiful people on campus, way older than I was, starts falling apart. "I don't know what to do. I can't face the father. I don't know what to do. It was just, I'm not going to go on and on, try to imitate this moment. And I felt so inadequate to the situation. And he was having a crisis of faith. It was the dark night of the soul for this priest happening right then in front of me. And I'm as unprepared, I feel as inadequate as a human being could feel. And I just sat with him. He wept, he talked, he wept, he pounded his chest. And then he collected himself a long while later, and we got in shape to face the Father. I went back to a college reunion long after I stopped that job. And I had moved to the West Coast. And I go back to the reunion, and there's this priest walking up the sidewalk. And he goes, Wendy, and he runs to me and gives me a big hug. He says, I have never forgotten you. I will never forget you. You were with me during the loneliest moment of my life. You were with me. So I learned being with is enormous. And I hope everyone who's hearing this, you should keep this openness to receiving people's sorrow wherever you go. I have received sorrow on airplanes. A lot of people on planes are flying their funerals. I just put my work down. I always want to get work done on a plane, but that's it if I have a griever in the seat next to me. What are you going to do? Okay. One other little tip I just want to throw in here because it fits here is an admonition. Don't rush to comfort. When we're very uncomfortable with someone's grief, we'll often say, oh, that's okay, or it will get better, and don't worry. And that's your anxiety. And believe you me, I still fight with it. I have to coach myself. Just be present. Be quiet. Don't rush to comfort. What happens, you'll see people do this. They rush to comfort, and what happens is the person starts stuffing that grief back in. So when grief is finally coming out, let it come out. And you can even urge it out, especially, and I have to say this in all fairness, to men in the dominant culture of our society, and also in some other cultures, learn that to cry is not manly. And what a terrible message to give little boys. I tell you that because human beings are built to be able to cry when distressed. And the tiny little boys that are allowed to cry, they're just as good criers as the girl babies. Come on. It's not a gender issue, but we make it a gender issue in some aspects of society and culture. And so I've been with many men who start choking out the tears and they're trying to rein it back in as hard as they can. And in those cases, I will say, let it come now, let it come out, let it be. It's okay to cry. So it's not a rush to comfort. It's sort of like, come on, you can do it. More like that. A man who I got him to attend, I begged him to attend an Alzheimer's spouse support group. He said, I'm not going to a support group. I go, please just go. And then if it's useless, you can tell me. But could you do me that respect of just go once? He goes, social workers, so annoying. And he came back from the group and he said, well, Wendy, it was all women and me. And he said, I loved it. I go, you loved it? He said, the women just cry. They talk about things their husbands do, their partners do, that makes them feel they've lost them. And then they weep together. One starts weeping and the other weeps and they weep together. And I go, you loved it? And he said, they cried all my tears for me. They cried my tears. I feel like $1 million. Isn't that something? They cried my tears. I did meet a man who ran a Alzheimer's spouse support group for men. And he said, it's not as good as the women's. He said, it's pretty good. We could use like a woman to get it going. All right. Now let's talk about, we're heading to unhealthy or grieving that is stymied right now. And the transition issue is grief versus depression. This is a issue that dogs clinicians of all kinds. And I think the hardest thing is that grief and depression have the same symptoms, if we want to call them symptoms. They're identical. Look at any list of symptoms. Sleep disturbance. Well, grieving people have as much trouble with sleeping as do people with depression. Loss of life's meaning. Again, a very parallel feeling. Withdrawal from others, very common to both. And this deep feeling of separation from others, which we do get in grief. You know, everyone's going about their life and we feel removed from it. Same in depression. Intense sadness. Problems concentrating, which is classic for depression, classic for grief. People grieving can hardly read a page in a book. I've had students grieving who let me know they had a loss, a major loss during the quarter that they were in my class. And I tell them, don't even bother doing the readings, please. I don't see how you could possibly concentrate right now. And then I would say that on the phone. And then I'd have a student weeping with the release of feeling understood about this issue of concentration. Frequent thoughts about death. People who are depressed do that, and especially people who are grieving a major bereavement. Loneliness, and also feelings of numbness. So since all of these symptoms are virtually identical, when we're responding to elders, what do we do here? I used to get so perplexed, it gave me a headache, because is this a treatable depression where I should consult with someone to get some meds going? Or is this grieving? And I know how to help people grieve or be there for grief. Is this a buildup of too much grief? Is there in fact something called complicated grief and traumatic grief? We have all these terms for something that we call crudely grief that goes on too long. And then we start thinking, well, maybe it's depression. So you see how mixed up this can be. So again, my teachers have been the clients and patients themselves. I was at a senior center, and on the big board, I was doing a class on depression to the senior center. And I said to them all, before we get into things about depression, I want to talk about loss. So I put loss at the top of the page. And then I said, can people tell me things that you've lost? And it was the liveliest thing I've ever conducted. People filled 2 blackboards. They actually brought in another blackboard. And we filled it with their losses. You know, friends had died. They lost the house they lived in. They couldn't garden anymore because their back hurt. I mean, and there was so much commotion in the room, I couldn't get them to stop. And I couldn't do the talk that I was there to do. And here's what was really interesting, is they all got really happy and animated. They started very low energy. And I saw before my eyes that if people can name their losses, it relieves them. It makes them feel, oh, I'm grieving. And one woman said to me, you made me so happy today. I'm not depressed, I'm grieving. And I know about grieving. I just didn't realize how much grief I had. And I just feel so much better. It's all paradoxical, isn't it? And that was a great moment of awakening for me. I said to myself, Wendy, stop trying to sort this out with elders, just forget it. And here's the insight I learned, another one from a nurse. I was giving a training to about 100 nurses, somewhere not far from here, where we are right now. And I don't even remember the topic in general, but I was talking about grief and grieving to the audience. And a nurse raised her hand and stood up, asked for the microphone, and to all of her colleagues, she said, I am in a state of grieving because I'm only 42 and I have a very aggressive breast cancer. And I thought that I was profoundly depressed until I realized that I was actually grieving, and it's different. And she said to everybody in the room, don't be afraid of getting antidepressant when you are grieving. See, she was a great teacher. She said this next sentence, because grief requires energy. And I didn't have energy. I took a low dose antidepressant, low dose, for the energy properties. And I have been able to be a good griever now. Everybody has to hear about it. And I am doing so much better because I got it. I'm getting it out. I'm talking about it. I'm not alone. I'm not isolated anymore. So grieving requires energy. That was a beautiful point. I bet there were about at least 25 people that ran out to get low dose antidepressant that day. You know, low dose, not a clinical dose, not enough to treat depression, but low dose, which is you get the minor side effect, the SSRIs, you get a minor side effect of that caffeinated feeling, which usually troubles elders quite a bit because it gives them more energy than they can handle. But really interesting is to use the side effect at very low dose. And so the person feels a little energy for their grieving, and very, very interesting and important. Grief requires energy. Okay. So don't worry about the distinction between grief and depression. Someone could get a little low-dose antidepressant, but they have to make sure they have the caring other. They have to have someone with whom to grieve. You don't just give someone medicine and think it's going to help their grieving. You have to make sure they have access to a caring other, which is not so simple in our society. I do want to note that dogs and cats are very good grieving others. They really are. Grief receivers, rather. They will receive grief and be, if they're close to the human, and always give people credit if they tell you, well, I do cry with my dog or my cat. But honor that. That's okay. This next section is on walled off emotions, unexpressed grief. So we said unexpressed grief goes around and nothing becomes of it. So what I'm talking about here, which we'll get back to at the end, is opportunities. Now, what do I mean by that? I mean that many people, not just men, many people wall off their grief because they are afraid of falling apart. And I want to honor immigrants and refugees at this moment, especially because immigrants and refugees to a new country have so much grief that they carry with them from leaving their home and leaving loved ones and coming to a new place, even for the best of reasons. And many people will build a wall around their experiences and never want to talk to their children about what happened. And what's the problem there? the grief that they carry is behind the wall, and so are so many other emotions. You know, we can't just put a wall around grief and be super loving and super emotive and have other emotions flow out of us freely. Well, that would be very convenient if you could select one emotion and build a wall around it, but that's not how it works with feelings. And you become a walled off to feelings person, and you're raising your children that way. So that was my husband's fate with both of his parents after his parents' families were murdered. And he's an only child, and so he had one world outside the house, and in the house was another world. And so she lived all her life, Barry's mother, with the Holocaust stories behind a wall, except for a few. So this is where I want to emphasize, and why I have always loved working in healthcare situations as a social worker. I've never worked anywhere but in healthcare, is because illness, and especially the approach of death, are the forces of greatest change in life, in my opinion, especially the approach of death. Because if not now, then when? People often seek to become complete. And to become complete, you have to come out from behind your wall and let people witness your most tender emotions. And what happens when you're very, very ill is that tender emotions become more available. So I'll tell you what happened with my mother-in-law, but I wrote this book, Counting on Kindness, when I was very young. I was just taking everything I learned from patients, friends, family members, elders, and I haven't reread it in a long time, but lately I've been looking at it again, and I found this passage. It's a quote from another person's book. A 60-year-old daughter of a woman with Alzheimer's describes how she soothes her mother, you know, when her mom wakes up and cries with fear in the middle of the night. And I always imagine that people with advanced dementia in the middle of the night, it's not only fear, it's also grief, because you can't get your bearings. How do you soothe yourself when you can't figure out where you are in time, place, all the orientations? And here's what the daughter said. I put my arms around her and I hold her. I hold her as I held my children when they were small and afraid in the night. As this summer, I hold my grandchildren. I hold her as she, once upon a time and long ago, held me. And I say the same words, the classic maternal, instinctive words of reassurance. Don't be afraid. I'm here. It's all right. I mean these words. I do not understand them, but I mean them. Perhaps one day I will find out what I mean. Whoa. That's a beautiful quote from this daughter. And that's what happened with Barry's mother. So she lived with us for a year, 3,000 miles away from all her friends. And I'm just going to skip to the ending, the very ending. The wall started to come down around her because she was so uncomfortable. The cancer did metastasize to her lungs. She had trouble breathing. We had her on oxygen, and then they gave her morphine pills, and she couldn't swallow them. They were so darn tiny. They just choked her. And one night, I just sat up with her. I was so tired. She was so tired. And I just rubbed her back and patted her back. And she let me really back to that moment. It was 8 years earlier, I had held her foot. And now here we are. And she was so different by this point. This is just a few days before she died. She let me rub her back and pat her and comfort her. And then I don't know what happened. I woke up at about 3 in the morning and my mother-in-law was in my arms. I don't know how that happened. I fell asleep, she fell asleep, and it was almost the Madonna position with me holding her. And I just sat there looking at her across my chest, and I just thought, I've just got to always remember this. It's amazing. And but the most important lesson was with her bath aide. Her hospice bath aide was an expert on grief and loss. And she could be teaching this seminar right now. She came to the memorial. She came to bathe my mother-in-law. I think it was twice a week. She comes to the memorial and she says, listen, I came because I have something to tell all of you. I don't know anybody here. I just want to tell you something. And she turned to Barry and she said, your mother cried the tears of the Holocaust into the bathtub. She told me all the stories she never wanted you to know. She told me everything. And I had to swear I would never tell you. Well, I'm not going to tell you. But I want you to know that she cried the tears into the bathtub. She cried and cried and cried with every bath. And she said, I'm used to this. This is what people do. It's warm, it's gentle. I suds their back, I wash their hair with extra tenderness, and out comes the tears of a lifetime. I just wanted you to know she had some peace. I want you to know that. She could not tell you the worst stories. She never wanted you to know. But I wanted you to know they were told. And it was comforting. Beautiful. Lots to learn from that story. Okay, the next topic is called grief ambushes. What is a grief ambush but an opportunity? What happens is you're watching a movie, maybe it's even a comedy, and remember movie theaters? It's really fun to go to movie theaters. And you're in the movies and a scene comes on and it's something that brings your grief that you haven't even thought about in a while right into your face. It's just the scene that evokes a powerful wave of a grief. Maybe you even thought you had settled down with that grief and you start sobbing in the movie theater. That's a grief ambush. And the reason I call it the ambush is because if you knew that scene was coming, you would prepare yourself and you wouldn't have burst into the tears you needed to shed. You would have protected yourself. So after my mother died, I did the usual things and year and a half went by. I thought I was kind of like over it, and I went to visit a friend in a far away from Dulles Airport part of Virginia, and I had to drive a long time on this beautiful road, and there were no cars. Beautiful. And I found an oldies station. Oh, you know what's going to happen here. A great old song came on that was very powerful for me during my adolescence, which is when I had the most issues going with my mother, as most girls do. And I cried rivers all the way to my friend's house. And when I got there, I still, had tears going. I mean, I cried like 45, 50 minutes straight, even after that song was over. And my friend said, oh, you were on the crying road. She said, I always do my crying on that very road. Isn't it a great crying road? I love that. You were on the crying road. So what I want to underline here is these are opportunities to let it out. A lot of people are embarrassed by grief ambushes, but they're good for you. And the most important thing is to not be ashamed and embarrassed and apologize to people. Just say, I just was ambushed with a big hit of grief. And what you'll do is you'll hear everybody else's stories about when it happened to them. We really need to be there for each other and allow that space. And don't rush to comfort. Show the person you're perfectly comfortable with them letting it rip. I even have said to someone, let it rip. You know, it needs to come out. And notice the crying road, you're not in the presence of a caring other. But the great healing was when I got to the friend's house and I couldn't hide the tears, and she received the last of it there. So it still holds. The best healing of grief is with the caring other. So watching the time carefully, there will be time for questions, but I want to move through this content. So I had a grief ambush. I went to a funeral of someone I didn't know because it was my husband's friend that he had known, but I had never met for whatever reason. So I go, I'll go with you. So I'm sitting in this beautiful church and I'm just sitting there and, you know, it was nice music and people spoke and giving my husband support. And then the brother of the deceased man got up and gave the most gorgeous, heart-wrenching talk. And I started sobbing. And Barry leans over and goes, you didn't even know him, Wendy. Get a grip here. Leave me alone. I'm grieving something else. I really need to cry, and if not here, then where? And I just really got something. I don't even remember now what that grief was, but I was ambushed. And it came out in a good context. What was the problem? At the end, all these people came up to me and said, oh, how you must have loved him. And I couldn't remember his name. I kid you not. I hadn't paid the least attention. That was very embarrassing. I had to fake it. That was bad. That was bad. I'm glad you're laughing. Good. Thank you. All right. The next thing, and then we're getting to healthcare situations. The next thing is anniversary reactions. Now, this transitions us to our role as care providers because a lot of what we must do around grief is teach people about grief and grieving. And whatever role you have in someone's life as a care practitioner, you can always throw in a teaching or two about grief and grieving. So when your patient says, oh, I just lost my sister 2 weeks ago, you'll be able to say something like, or ask, do you have anyone to grieve with? See, that's just a wonderful question I hope you'll take with you from this. We all have been reading about social isolation. It is a very real problem, well researched now. But I think one of the great perils, which is what I started with today, is people not understanding that they need to grieve in the presence of others. So as practitioners, we can ask about, is there a context where you can be sad and talk about and just be true to how you're feeling right now? And someone might say, well, there is this after church donut hour, which I usually skip, but I hear people do a lot of talking in there. If I were that practitioner, I would say, great idea, just try it, even if you hate donuts. But that's good for you. That's a good thing. Even if you're not much of a joiner, it might really relieve you. If that's really what goes on in that room, you could try it. So that's a nice tip you can give someone. Okay, anniversary reactions we surely can teach and use in our own awareness. So all traditional cultures are aware of anniversary reactions, which is a psychological term which was named, I think, in the 1950s here in the United States. But what is an anniversary reaction? At the time of year, that's an important phrase. It's not an exact date, but when you enter into the time of year when you lost someone a little bit less than a year ago, that first anniversary is the hardest one of all. And we don't know why, but it's well understood by traditional cultures in their rituals that when you first lose a person of great magnitude in your life, there's acute grief and shock, and then people can move into a kind of blessed numbness for a while, where they're kind of robotic even. And they often say, I don't know why I'm functioning. They're not really functioning, but they're making the moves, the motions of life. And what's really happening there is this, I think it's a natural kind of soft wall that goes up, and it's not anything we do deliberately, and we carry on and we have intense bursts of grief, and then you're in this kind of mid state. But watch out what happens around month number, and here it's highly variable, but month number 8, 9, 10, somewhere as that anniversary approaches, you know, the smell in the air, the feeling of the season is bringing visceral memory back. So that's what triggers it. I think neurobiology one day will probably be able to even see the brain lighting up. So the time of year starts to come around when you lost that person. And you know, I drove one of my granddaughters to her violin lesson several years ago, and I knew the teacher, really positive, great with children teacher, you know, she could do that Suzuki method and be cheerful about it. I admired her, and I'm dropping my granddaughter off, and I see the teacher, and I didn't often bring her to the lesson, so I hadn't seen her in a while, and she looked awful. And there wasn't spirit coming out of her. And I just went up to her. I said, hi. And she just said, she knew I was a social worker. She said, I'm just feeling like so bad. I think I might just be depressed, like really depressed. The kids aren't lighting me up. And I just said, was anything happening around this time last year by any chance? And she goes, oh my God, my mother died. My mother died. I said, oh, you're in the anniversary. This is called the anniversary reaction. You're not depressed. This is grief. This is the hardest part of grief. It's right now. And she goes, oh, that makes so much sense. Everything just fit together. And she cheered up a lot. There is that paradox again. You could call this the power of naming. The power of naming is to give something a name, and then the person feels they have power over it because they understand what's going on. And she wanted to rush home and call her sister and join together because surely it was happening to everyone, and it was. So all traditional cultures have something for the anniversary reaction, and I'll just depict that by saying, again, I was talking about this in a training. I love when people from other cultures are at the training. And this was a man who had just moved to the United States from Africa. I wish I could remember which country in Africa, but I don't. And he said, oh, I must tell you, my people, we have a tradition that's beautiful, where after you lose a mother or a father or a husband, wife, or a partner, you wear the grief gown. And this grief gown, when you walk through the village, everybody knows you are a mourner. And so this is what we do. And at the end of the grief year, we have a ceremony for taking off the grief gown. And it is so much like what you just described. And I thanked him so much. And now when I tell that story in one of my classes, I always say, I know in this room of 25 people, at least a few people should be wearing the grief gown. And wouldn't that be wonderful if we had a way of knowing someone was wearing that gown spiritually if we knew who the grievers were. Be a really very good practice. So it's very important, and this makes our transition as a practitioner. You can teach people about anniversary reactions. You can even tell them to watch out for the grief getting more intense than ever as you approach the anniversary. There is no month when we can say, this is when it's going to happen for you. There's no scientific way to identify when it's going to happen, but it does happen. And make sure you are around other people, which is what the grief practices do in traditional cultures. I want to tell you a few things right before we go into a chance for you guys to ask questions, because I've been giving you a lot of ideas, but how does that translate into our work as practitioners? So, of course, I have a story for you. And I want to honor a former colleague of mine, Patricia Rickert, a PA, physician's assistant. She actually taught at the program here at UW for a while. So at Pike Market Clinic, she was the women's healthcare provider. And the short version of this story is she insisted on 30 minutes with each patient to do women's healthcare. Then lots of fighting went on. The doctors had to go to 20 minutes at that time. And they said, Patricia, you can only have 20 minutes like the doctors. She said, no, I'm walking out. I'm walking out right now. No, no, don't walk out. All right, you can have the 30 minutes. And then a couple of years went by and things were budgetary and they were going to just give the doctors 15 minutes. And they said, that's it, Patricia. You're going to 20 minutes. Don't argue with us. And I found her weeping in her exam room that she was going to have to leave. I said, Patricia, I'm not on anybody's side here. I just need to know, what is it that you need that time for? She goes, oh, Wendy, yes, I could do the physical exam. I could do that in 15 minutes. I'm really good at it. She goes, but what everyone does not understand here is that when I touch a woman in a certain way, in a certain place, a lot of times, I'm just trying to do the abdominal part of the exam where you're checking on the ovaries, and so many women spring back and they were sexually abused in childhood. So many women make their first story about what happened to them in my exam room. And I have to have that extra 10 minutes for the sobbing. That's why I'm going to have to leave unless they give me the time. I will not rush a person who's finally talking about such a profound sorrow and rage for the first time in my exam room, and I'm going to hurry them because I'm on a time limit. No, that does not work. It's too sacred to receive somebody's grief and to do so fully with a full heart. And then I complete the exam and I refer them to help. Wow. So what I wanted to end with right now is, and now we'll have some good discussion through the chat, through your questions. It is very difficult in the way healthcare is being managed. Managed is the key word, for the greatest expediency, where issues of grief and loss are not primary. It's not a primary billable, respected part of healthcare, and it ought to be, but it's not. And so we have to find a way to figure out what is most essential. And I will say my opinion now, and I'm eager to hear responses, that when someone has a breakthrough, a huge breakthrough, you know when it's happening, like what would happen in Patricia's, not every time she did a women's healthcare exam, but often. When that happens, you have to stay with it. I think morally, ethically, and yes, you're going to be late. Your day is going to be late. You're going to inconvenience other people, yes. I think we need to recognize when a sacred breakthrough has happened, someone has found their sorrow, it is finally coming out, and sit with it. Be the caring other. And then you can apologize to the patients. You keep waiting and say something came up with a patient and I needed to take care of it. And everybody knows when their time comes, you'll do that for them. And people understand. And I think I have always loved healthcare settings because, as I said, that's an occasion when you're being listened to, hopefully heard and seen, and maybe touched. And just, we had a doctor at Pike Market Clinic who had a beautiful way of just sort of holding your arm when he was doing a blood pressure, getting ready to take your blood pressure and everything. And all my female patients would go, oh God, I love the way he touches my arm. But anyway, no, but the touch opportunities are part of what can draw out someone's pain. And then one more thing to say in this part is, I hope you've gotten the message, everyone, that taking care of your own griefs along the way is crucial. So when you have someone in your own life die, or you've lost them in some other manner, when you have grief, be sure to find your own caring other so you can show up for other people's pain. It's a kind of healthiness you have to have in your own soul and spirit in order to be able to bear sitting with someone else's pain. So it's really crucial self-care. And I used to go to the funerals, not very often, but I would go to a funeral of a patient of mine who had died, who I had spent a lot of time with, especially when I did hospice work. And it helped keep me open-hearted because I brought the situation to conclusion. So I'll say my formal conclusion to all of you after we get to hear what has come up in the chat or in the questions. Barbara, what?
Well, I just want to repeat something that Vladimir put in the chat, which was, this has been an incredibly powerful webinar, and thank you so much. I actually do not have questions that have come up in the chat, but I would encourage others to respond to Wendy's request about your thoughts, questions, experiences that you would like to share with her and with others, or that you would like to ask her about in terms of her wealth of experience and understanding.
And if there aren't too many questions, oh, we have one right here in the room. How lovely. So I'm going to repeat it back. Yes.
No, I was just curious, you were talking about touch and the power of touch, and
maybe I can come over to you and, no, that's okay. And then maybe you can be heard this way. Yeah, go ahead.
So as you were talking about the power of touch and the impact that it has, and in this increasingly more telehealth
Oh,
that
yes.
we have,
Yes.
if you had other strategies that you use to kind of, I don't know.
That's a great question. Very timely question. Thank you. Yes, I faced this as a teacher, teaching heavy clinical subjects with my students. I loved being in the classroom, and then I have to stay on Zoom because I can't be exposed to COVID at all. And I have learned that you can do a lot with Zoom. And I would say the key to it is your open-heartedness. You have to make yourself a little bit more vulnerable as a practitioner than maybe you would do in person. It's very interesting because I've noticed I have told my students more about myself and my own learning and growth as a need to get the level of conversation where it needed to be. And there's what I call self-disclosure in the service of the patient or the client. And one has to be very artful about self-disclosure. It has to be something that is well healed within you that you can then talk about with a patient. And then the patient feels your openness, yet they don't have to become your caretaker. You're not sitting there crying with them. You are telling them that you went through something very difficult. Let's say I used to disclose about my grandfather's Alzheimer's disease and the very difficult care process we went through long after it had healed for me. Wonderful self-disclosure to help a patient open up to me. So I think on telehealth, we can be very mindful and even have thought about in advance, what could I share that would open up a greater level of exchange between us? It's necessary on Zoom. Thank you for just a wonderful question. That's what I've found has helped. Do we have another question?
That was a great question. Simran said this webinar came at the perfect time. I lost my father-in-law to pancreatic cancer last week, and I recognized techniques I can use with my family to help them with the grieving process. Just wondered if you had any other thoughts that you wanted to add to the perspective that Simran gained for addressing grief in the family based on this discussion.
Thank you very much for that and telling us about such a recent loss. And, you know, one thing you can do with others in your family is talk about difficulty with concentration. You know, I have found that if you help others you're close to by describing your own quote unquote symptoms of grief, it makes people feel kinder towards themselves, especially if you're in healthcare. People probably respect you for your knowledge in that realm. And so you just can say, oh, wow, I can't even read a novel right now. I read the same paragraph 50 times, and it will help people who are in your family. So it's interesting when we help people who are in our intimate lives rather than professional lives, we have to up the vulnerability because it's not self-disclosure in the service of a patient, it's self-disclosure in the service of your family, which is a whole other amplitude of emotion. And it's good for the person who does it. So my best wishes to you. Being a family leader in displaying that it's safe to have emotions, that grief that's received is going to heal. That's, I think, that kind of message, and you modeling it. Thank you for that.
Yes, thank you. Lori asks, how do you help the eternal griever?
Oh, what a great question. These are really good ones. You know, there's the perpetual ones and the eternal ones. I've heard these terms used many times. The perpetual grievers are often the spouses of people with dementia because they grieve morning, noon, and night for someone who's right in front of them. And I said to my grandmother, it's like grandpa died and there hasn't been a funeral. And she goes, oh, thank you, thank you. Oh, that's what it's like. There's no funeral and it's happening like 15 times a day. He dies for me and I'm all alone. And it helped her. So perpetual grievers there are many situations where there's perpetual grief, by the way, in different kinds of illnesses. And we as healthcare practitioners, that would make a really good conversation just by itself, maybe for a care team, to talk about the patients who seem to be perpetually grieving. I think the eternal ones, what I mean by that is, and I hope that's what you mean, is there are some people that grief has become their way of life. They like topped out on too much grief at one point, and then it's just how they communicate and how they live in the world. And they almost, and I don't mean this in a negative way, they're almost welcoming or most comfortable when they have a palpable grief in front of them, because they're living in that world all the time anyway, and actually can feel more synchronous with other people when there is another loss in the family, and they don't have to feel so alone in this eternal grief that they live in. But that route towards living in that way has many, there's many different routes to that. And that's like a final common pathway. That's what we say as we look to try to understand a complex phenomenon like that. There's many, many ways people reach the eternal griever stance. But I think in healthcare, we need to recognize the perpetual grievers. Thank you for that question. Do we have another?
Yeah, David has an excellent question also. Is it not possible to grieve in solitude? Or put another way, does grief in solitude not permit relief?
Oh, that's another great question. Wow, you guys are amazing. Look, true confession, my favorite times to grieve are driving I-5 northbound about 75 miles an hour with an oldies station, where you can go 75. Do they still have that? I hope so. And crying in the car with oldies still remains my favorite pathway for letting feelings out. And you'll notice no one else is in the car in those stories. So I still avoid what I must do, which is grieve in the presence of a caring other. And so to return to the beginning of this talk, it's not that we can't grieve in solitude. I obviously prefer it. Many people who become helpers of others, we are not so good at accepting help or being vulnerable around others. We in the helping position are very comfortable in the helping position. But to be in the vulnerable position of the one being helped is really hard for us. This is very common among healthcare professionals, very common. So being a great fan of avoiding my own advice, I do actually make myself, when I'm with the right person at the right time, and I recognize I am in the company of a wonderful person who can receive my feelings, a very trusted, very small group of people among my friends that I am able to cry with. And if it comes up while I'm with them, I do not allow myself to hide. That's been a very rewarding practice. So I'm on alert when I'm with these very sensitive people, extremely sensitive. And we're talking about something, and each of these people has a knack for asking me the right question. And then there I'm at a choice point. Do I avoid or do I go for it? So that's my reply to this wonderful question, which is, go ahead and grieve in your own way in what feels right to you. But this truth still holds that there is a level of release that occurs when you're with someone who receives your feelings. And anyone listening to this program who has never done it, and I bet we would find many people in the healthcare professions, you've had other people cry on your shoulder, but you haven't done it yourself. And try it if you find and recognize there's someone in your world who's very capable and would be honored by, deeply honored, if they could receive your grief. It is an honor to receive the grief of someone you admire and love. And think of it as giving someone a chance to be good to you. And that does help me do it. And I have done it. And I will say the relief was extraordinary. Better than playing the oldies on the crying road. Any other questions?
Yeah, Claudia said she works in a hospital and had a patient in his late 80s who was grieving the loss of his wife of 60 plus years. He was told by other providers that he will eventually get over it, which I thought was appalling. What are your thoughts on this response of getting over the loss grief or moving on?
Yeah, I think it's a terrible response. You know, someone who's lost a partner of 50, 60 years, it's much healthier to say to them, you must feel like a part of your body is missing. But virtually everyone says that if you give them the space to do it. That will be comforting to them because they're feeling as though part of their body is missing. And to say to them, try not to be alone now. Try to be with other mourners. That is very good, wonderful advice. And, you know, even small communities have grief groups now. Sometimes you have to call around to find them, and that's what social workers are for. And we love to connect people with places to grieve. And now, because of technology, people can go to a spouses and partners grief group on Zoom. It doesn't have to be local. And that can be, I know someone that went to one of those. She liked it okay. It wasn't the world's greatest right after her husband died, but it was helpful to her during the acute phase where she felt like nobody could really understand the depth of her loss, but other people recently widowed, and they did. And then after the acute phase moved on and she was in the numbness, she didn't really want to go to the group anymore. So that's, yeah. So thank you for that. I really agree with what you said.
Marianne
I think
asks,
we have time for one more.
okay, Marianne asks, how can you differentiate between grief and dysfunctional grief processes? For example, when people lock themselves away, lose jobs, or disengage with life?
Yes, thank you. That's a good one to end on. Thank you. That's a profound question and an important one. There we get back to that question of what's grief and what's depression. And sometimes people do have both. But regardless, again, I've learned to let go of trying to figure it out. I do know that isolating behaviors are unhealthy. It's unhealthy grief, and it's dangerous for people who are depressed. So, you know, you can let go of the whole thing of what's going on here and just say to the person, you know, this could be your grief, and it's not healthy for grief. And you could have biological depression, especially if it runs in their family. And that's where I love to say to people, you know, since you have a bit of biological depression in your family and you've had these gigantic losses, let's give you the energy to grieve, but you can't do this alone. So, I mean, don't be afraid to be very prescriptive about how grief works and that you must have the company of others. And also depression thrives in isolation. We want the depression to go the other direction. So not being isolated is crucial for your mental health. And then you really, what I do is I say to the person, you've got to tell me something that you used to do that made you feel life was worth living. Just tell me one thing, and I'm really stubborn about it. I don't know. No, one thing. I don't care what it is that you used to love that brought life to you. And I'll tell you just this, and then I'm going to say my ending comments. When someone will tell you something that used to make their life worth living, you have a great, it's like a light bulb, and you both know that can be a guiding light because you can help someone at least pick up that one thing and start to reverse process? Thank you. That was a beautiful question. So I just wanted to end by saying so many thanks to Barb for just allowing me to have the whole time for this topic, one of my favorite topics about which I am passionate. And my thanks to all of you for attending, because I know you can spread a lot of this around to other people and be teachers as well as healthcare providers, to family members, to friends. We all need to know more about grief and grieving. But most of all, that all of you, the next time a patient or a person in your life has a grief ambush, I know that you are going to be there for them. And that makes me really happy. So take care of your open heart. Thank you very much. Thank you. And nice, in a real room, you get to have applause.
Yes. And
Oh,
I
that's
would,
great. Look at that.
yeah.
Hearts are floating up there.
Thank you so much, Wendy. I also want to thank and acknowledge all of the attendees, and for witnessing this experience and sharing your experiences and insights. It's been, as others have said, just a very profound hour and a half. So thank you so much.
Thank you, everybody. Great question.
And thanks to School of Nursing Video Tech also.
Yes, wonderful people.